neighbor, but we at this junction, we like to service our community. During the pandemic, we served food. We had food distribution. We had the COVID screenings, COVID testing, and virtually we had our services. So we basically maintained. There were a lot of churches that did not sustain what we did. We have an annual health fair. This is kind of like a little sample of some of the things that we share at the health fair. And our health fairs have been collaborative. We've had sororities, we've had other churches, we've had youth groups, we've had schools that collaborate, and we make sure that we service everybody within our program. I do want to introduce you. Where is my pastor? Pastor J.T. Thomas. I do need to acknowledge him. Where are you, Pastor J.T.? He's upstairs. He's down. And his lovely wife, Lady Angela Thomas. Would you want to say a few things?
Good evening, everyone. My name is Angela Thomas. We welcome you to our church. We are so happy to have all of you here. We're very appreciative. I'd love to acknowledge Miss Janet because she does so much. We know it takes a village, and we want to be that village here in our community, in our neighborhood. So we do all of these things, but I don't think that we can do them as well as we do without having it. So thank you for being here, taking time to see our church. And I'm very, very encouraged by all of the people that are here. I didn't expect a group this large. I'm happy to have each and every one. God bless you.
I shared, my name is James T. Thomas. I'm the pastor here at Calvary. I've been in the city of Detroit for about 5 years. My wife and I are originally from Chicago. She is also a executive for Marriott Hotels. I am a tax manager for Kelly Services. So I pastor and do this. We do this a lot. But we're just grateful that we're able to pour into this community on a timely basis, the efforts that is needed to speak truth to power to some of the challenges that exist here. Many of you are aware during COVID-19, during the pandemic, we were a hot button city. This was a part of the nation where all the attention was drawn to. We're just so appreciative of people, like Janet and her team that stepped up to the plate. And we resonated not only with the community here, but this went throughout the entire state. So we're just excited by your presence here today, and we hope that all that is shared, you're able to take back and let them know that the city of Detroit is on a resurgence, and we're going to do the doggone thing. All right.
I want to show you our campus, but I do want to acknowledge my team. We have a team. We're called the OLC, the Old Lady Crew. All of my Old Lady Crew that's here, raise your hand. The OLC went from leaders, we got harvest, food banks, brought food back. We service people weekly, at least 50 families we service, at least every week for, and at least 50 families a week. We made sure that they had food and services. We did resources, made sure that we connected them with the resources, the appropriate resources that they need. Our connection is, I am the Faith Community Nurse Coordinator for Henry Ford Health System. And under Henry Ford Health System, Dr. Kimberly Donald Wisdom, we have in Detroit 20 to 25 churches, 20 active to 25 churches that are connected, and we meet monthly and we share our resources, we help each other, we do things together. We have a documentation system that is totally awesome, where we can document the number of people that we touch and the lives that we touch as well. We also have about 20 in Macomb County, and we have a reach of churches. And the churches have people who are health ministers, they're faith community nurses, and they're lay people. I train them, they train to be able to deliver services for mind, body, and spirit to the members in their congregation, because nurses and the health ministers are trusted messengers. So what we do is things that they need, they trust us. So we deliver the messages for them and make sure that everything that they need is addressed. Am I forgetting anything? Any other? Oh, yeah, we talked about grants. I'm so sorry. We had a grant. We had a grant last year that 6 churches that are in our network received AEDs. There's my AED over there, and also training for 5 members of each of their churches on emergency preparedness and how to address those that have medical emergencies. So we received the training. We have over there the kit. It's for schools and communities. And what we do, they gave us about 150 hands-only CPR kits for infant and child and adults. And so what we're doing, we are offering CPR classes monthly, and those that come, we hand them the boxes so that they can train other people in the community. I just asked them to at least entertain 10 people. So we want to make sure that everybody is equipped and know how to use an AED and to do CPR. So that's some of the things that through Henry Ward, we did grants. We had a grant regarding cancer, and those models that are over there was from our Cancer Faith Heals, where we educate the community on breast cancer, prostate cancer. And, you know, the visuals make a big difference when you see and can feel the lump, and it has impacted the community. We also have had a grant with for blood pressure with American Heart Change Control. And that was, and I hate that they stopped it, but that was a website where we trained the people to educate and to learn how to take your blood pressures and to monitor your blood pressures. And also, we put it in the system and we would connect them with a healthcare provider if they needed to. And this was very impactful within the churches because, you know, I see you on Sunday. Did I catch you all going out the door, getting those blood pressures? That nobody got out of here without you. And we did have a couple of people whose blood pressure that was at the point where we had to send them to the emergency. So we try to walk the walk and talk the talk of good health. So anything else? Jack. Oh, DPP, Diabetes Prevention Program. We trained our faith community nurses to be lifestyle coaches for DPP. So, you know, pre-diabetes, we want to make sure that you don't go into diabetes. It's been a very successful program. It is a 2-year program, and having it at the church, we had it at our church. And we did have, your A1C went down during our class. Look, I'm calling them out. But we did have some whose blood sugar was within almost 1 over that came back down, and we were able to help them to just basically learn lifestyle changes, you know, increase your physical activity and also eating properly and being able to track what you're eating, which makes a big difference. So if you know that you're only supposed to have 33 grams per day, and you look and you say, well, it's 9 o'clock, I want And I've already had my 33. Well, I need to put that to the side. But being educated on what you should be putting in your body to make sure that you're healthy. So that was our diabetes prevention program that we trained our nurses and lay health ministers on that as well. But yes.
Well, I'm part of road workers. We got the church nurses, the missionary resident Baptist. So you don't go to school, you should see me fly water. Yes, so I used to fly water. Both me and Janet are both on two things to the community better. All of this. And also first you on the board of the Michigan Progressive Council. Brought to me in newspapers and stuff all over. 4 years this year. I'm very proud of the faith community group. I'm very proud of what Janet is bringing to the church and what she's trying to do in the God is sick on and off and having we did that. I'm not the guy actually, where I'm part of 54 years on that group. But we're trying to reestablish the things that already started. We're going to start at Tuesday on the 6th of July. Janet and I, we are so close. We're like sisters. And we actually grew up in this church with our moms.
So, all right. Thank you, Fred. She could talk all day. Oh, yeah, we quite a few of our members are a part of the Alzheimer's research program and the studies. And would you like to talk about it? Would you like to expand this?
Yes, well, we've been fortunate to hear the nurse program to be educated in many multiple ways. Many of us participated in the vaccines that were January. In addition to being active in all kinds of studies. We've got a lot of education, and it's going to do whatever.
Yeah, any opportunity for research, help, or whatever, they just have no other choice but to participate.
Thanks to Janet's hard work, the same numbers that we see, the phone numbers that we see around research participation, some communities we don't see anymore. Because they have these trusted sources in this communicate with the directly to them instead of coming directly from us. And then guide them to the right resources. So we're so proud of Janet and this whole team. And we're very proud of community members, also church members, that trust with this institution and trust the care that we're trying to bring to. So I think
I'm not a nurse or anything, but people are asleep on the faith-based community supporting their community, not just in African American, but any community that is a trusted source. And if you want to have an impact on disparities in health, you go to that leader, that pastor. They developed so many health ministries within the church. Maybe they're not part of board services, but I have some people want to connect with you, Jan. No, send me away. I'm really not in Detroit, but I'm still working for Detroit. But anyway, don't sleep on it. You know, even with the clinical trials, if the numbers, if you look at the numbers you get from the city of Detroit, when COVID was going on, more people received their vaccine and participated in the clinical trials for Moderna and Pfizer more than coming through the hospital. Also, the COVID vaccines, more vaccines were done in the faith-based community than at TFA. Is that TFA? In California. And that came from the city council. So don't sleep on that. That is a way to deal with equity, diversity, equity, and justice. And when you look at it, if there's any injustices going on, you might think it's affecting a certain population of people, but it's like a domino effect. It rolls over to everybody. And if we don't do something to make those changes and work on it, it's not going to improve. But Henry Ford, I want to say, is doing an excellent job of this right now. They're moving forward. I didn't want to come to Henry Ford. My father didn't want me to come to Henry Ford because back in the day, around 1958, 1959, I got a story to tell. It was a Sunday hospital out in Southwest Detroit, and the Dr. Thornton, my mother had breast cancer. And he said, and Henry Ford had the best doctors and the resources. My father worked at General Motors Corporation, had Blue Cross Blue Shield, and we came to Henry Ford for my mother to get services. And they put her in the basement and did not service her because of the color of her skin. My father wouldn't even come here. And when I said I was coming to report, I remember that I was a young girl. But from there to now, I'm not holding a grudge on it. I'm not upset about it. But it's dear to me to see the movement that Henry Ford Health is moving toward diversity, inclusion, and doing that. You don't know how dear that is to me. I had to forgive what happened to my mother and move on to try to even improve that.
Okay, so I want to show you our beautiful canvas. We do have a daycare in our building, and we're just so happy to have that light for our babies. So we just want to say thank you for the donation.
Oh, that's it's large. We have a very large donation. There's even more in the storage room right here. It's going to come on display. So we're so very, very grateful for this donation to the community because we have so many moms and families that are looking for these resources, and this is another hub where they can come and need it just. And I also want to point out that there's a full exam room in this church right here.
Yeah, first aid room. I got a first aid room. And if my people are racing, if you have any questions, just pull on them because they can answer all of it.
I would just like to stand up for a moment and just acknowledge the amazing job that Janet and Sharifa and Misha and others have done. But I don't want us to leave this amazing experience without acknowledging people at Henry Ford at the CEO level. We have had decades of CEOs, whether it's Gail Ward, Nancy Schlichting, Wright Lassiter, and now Bob Riney. The CEO has set the stage and set the culture. And we all oftentimes talk about it takes a village, and that's absolutely correct. But I'm saying it takes a C-suite, because if it wasn't for them dedicating money, the sponsorship, they've done amazing work, and it's actually set the background for these kind of things to be built upon the infrastructure. So when we think about Henry Ford, think about those CEOs, and that's what it takes. CEOs that gave people the ability and empowered people to go into faith-based communities when it was thought to be proselytizing, like, why are you going to those churches? And we knew in many instances that's where it's going to be very important. So please, let's acknowledge the CEOs, because it was that leadership at the CEO and at the board level when we talked about the vaccines. Bishop Van, who's on our board, who passed one of his forward trips on East Grand Boulevard, we doing like 500 vaccines a Saturday for 4 Saturdays. So 2,000 people were vaccinated in Bishop Van's church. So what Wilma and others have said, it takes board leadership, CEO leadership. It didn't happen, without that intentionality. It didn't happen without amazing work that Janet, the faith nurses, others have just embraced it and said, we're going to run with it. Thank you. So I just want to acknowledge this.
And now we're just going to take you to a very brief tour of some of the great resources that are here at the church, so you get a feel of some of the things that put into our communities. Because as we're planning this activity, we're trying to see what community resources are here in our communities and what's most important to be able to see some of those resources that are right here. So If you put down on your game card a health performance, you can circle it. If you put down a daycare, you can circle it twice. There's one for kids and one for older kids that are kids. You write it twice. So, and there's a community garden across the street. So that's 4 things. You can mark off your list. They're right here at the center, where you just go all around it to see what's there and not there. So as you continue this tour, please be cognizant of that. It's got 4 things on your card. Okay, so we can start to map this way. Oh, also think about ways to help. You can always just store materials, applications, or beads, tapes.
I would like to water this line.
Sort of technology.